You know, a question I get a lot, especially when sharing patients with you guys who are doing surgery, is, hey, I've been treating my pain. I've had surgery. I've had a broken bone. They gave me pain medication. When should I stop taking my pain medication?
It's a great question. I mean, folks will come in all the time. They don't even know why they're taking a medication. They'll say, hey, somebody gave me this. And I'm like, oh, why are you taking it? Well, I don't know. Somebody gave me the medication. But I mean, my rule of thumb is if I give you a pain med, you never have to take it. I'm giving it to you because I don't want you to be suffering with, severe pain or even discomfort enough to where it keeps you from being able to sleep is the biggest one for me, but also to be able to do your exercises, therapy, things of that nature.
Right. Sometimes we will use, in fact, most of the time we will use anti-inflammatories for pain. Obviously, anti-inflammatories in general are easier on your system. While they have some side effects, they're usually not very prominent. You might take an anti-inflammatory a little bit longer, but definitely pain medication is something you would take as needed. A lot of people need it the first 2 or 3 days, but the majority of people not really after that, maybe here and there, but that's it. And I know a lot of people coming out of an urgent care or an ER, even though they provide good paperwork and information about what you have and what they're giving you and why they're giving you what they're giving you. I think in the confusion of being hurt and going in and coming out and you're still hurting, get a little confused. Definitely, if we've seen you and we're part of that treatment, you can always call us. A lot of times, a quick clarification. A lot of patients get off a lot of medications fairly quickly.
Sure.
And even the ones they're taking regularly, I think the majority of my patients within 2 to 3 weeks aren't even taking those anymore.
Yeah, we're pretty explicit. If we really want you to take something on an interval, we're going to tell you that part. Like I'm saying, I give out after surgery a pretty healthy number of meds, but none of them are that strong, and they're doing something different. Anti-inflammatories are going to help with pain and inflammation, swelling. I can give nerve pain meds, gabapentin, because that'll help with some of that tingling, help some of the shooting sharp, stabbing pains. Narcotics, there's a lot of different types, so usually we use more of the mild narcotics nowadays and try to avoid anything heavy unless we absolutely have to. So again, all these things have different purposes. I try to get patients to understand at least the fundamentals, and I'll even put it on the pill bottle, what this is for. So, and if you're having a reaction to something, for the love of God, please stop it. Don't take it all weekend long. It's like, doc, every time I take this pill, I'm having vomiting and I'm constipated and I'm covered in hives. And they're like, but I kept taking it. I'm like, you don't get an award for that. I promise.
Yes,
I'm not giving you a gold star.
Stop it, call us and we'll give you some
absolutely,
direction.
Absolutely.
Maybe even be able to provide an alternative that doesn't have those side effects.
Exactly.